So with most cases of glaucoma caught early enough, most patients can drive. And what I mean by that is we have gotten so good at early detection of glaucoma. So if you're going for your yearly eye exams and somebody is, catching these signs and symptoms of glaucoma early and you're getting treated early, what I say to my patients is rest assured, in most cases, this has to be nothing more than a nuisance to you, meaning you just have to come to the eye doctor more frequently. However, in more advanced cases of glaucoma that didn't get caught early and are more aggressive, the concern, of course, is always that if there is enough damage to somebody's peripheral vision, yes, especially in Pennsylvania, there is a section on the DMV form that we have to fill out saying that that driver has 120 degrees of peripheral vision, uninterrupted. So we do have to make sure that somebody's peripheral vision is wide enough in order to drive. And that would be an instance where glaucoma would limit somebody's ability to drive if their peripheral vision was damaged enough. Again, if you're coming in for your yearly eye exams and getting checked early enough, that is completely, in most cases, preventable. Glaucoma does not cause blindness in all patients. And what I mean by that is glaucoma is a slow, progressive disease process that damages your peripheral vision. And the vast majority of my glaucoma patients, when we catch it early, sure, they may have a little damage to their peripheral vision, but not even anything that they notice when they're going about their activities of daily living. Some of the saddest cases of glaucoma that we have are the patients who, don't get eye exams their whole life. And by the time they come in for an eye exam, so much damage has been done that they're really down to, as I call it, sort of that tunnel vision, and they have no idea. And, that's when, some of those patients can become considered legally blind because of a result of how much damage has been done to their peripheral vision. So there are cases where glaucoma can be mistaken for other things. So for example, there are patients who have high intraocular pressures. Our standard is that intraocular pressures typically should not read above 20, but there are patients whose intraocular pressures just naturally read above 20. And through, testing, we may determine that, hey, that 20 is totally normal for that patient. And they may have something called ocular hypertension, where the pressure inside of their eyes simply reads a little high, but that's not causing any disease process inside of their eyes. Similarly, we may look in the back of somebody's eye and determine that their optic nerve cups look a little large. That may be normal for that person. They may have been born that way with a naturally larger appearing optic nerve cup. We call that physiologic cupping. Again, we need to do more advanced testing to determine that that is that person's normal and not part of a disease process. And then sort of another thing that we do when we're screening somebody for glaucoma is we do tests of somebody's peripheral vision. And there are certain defects that can show up on that peripheral vision testing that can mimic glaucoma. So again, this is where it's so critical to, be coming in for yearly eye exams and have a, skilled eye care provider looking at these tests, analyzing them and determining if any of these tests are abnormal, if it's a sign of glaucoma or if it could possibly be something else. So people who are most at risk for glaucoma are absolutely people who have a family history of glaucoma. It does tend to be genetic because glaucoma in most cases is a slow progressive disease. This is something that we do see in typically people who are 60 plus, although we can certainly pick up the signs of glaucoma much earlier than that. We do see it more in certain populations. So for example, Asians and those of African-American descent are much more likely to develop glaucoma. In fact, African-Americans, unfortunately, are 15 times more likely to develop vision loss as a result of glaucoma. And then finally, people with certain systemic conditions such as diabetes are at a much more higher risk of developing glaucoma. Because we know that had we caught that early enough, even in somebody's 40s, that would have been completely preventable. There are so many ways to treat glaucoma. There are eye drops. There are simple in-office laser procedures that are covered by your medical insurance. There are surgeries. There are, almost too many things we can do for glaucoma to name at this point in time. So while glaucoma is not curable, it is completely treatable. And we can slow down damage that is already taking a lifetime to cause any noticeable change to your eye. There are currently 3 million people in the United States who are diagnosed with glaucoma, and there are many more who are undiagnosed. So some of the saddest cases of glaucoma that we see are the patients who have not been coming in for yearly eye exams and patients who went their whole life without an eye exam. And by the time they come in to see us, there has been so much damage to their optic nerves, unbeknownst to them, that they have just this tunnel vision, and this is what they're left with. And to us, that's just tragic, in a word, because we know that had we caught that early enough, even in somebody's 40s, that would have been completely preventable. There are so many ways to treat glaucoma. There are eye drops. There are simple in-office laser procedures that are covered by your medical insurance. There are surgeries. There are, almost too many things we can do for glaucoma to name at this point in time. So while glaucoma is not curable, it is completely treatable. And we can slow down damage that is already taking a lifetime to cause any noticeable change to your eyes. So that is why I encourage anybody, actually everybody, to come in for yearly eye exams to be screened for. And those who are most at risk for glaucoma are people who have a family history of glaucoma, people who have certain systemic conditions such as diabetes, people who are 60 or over, simply because it is a slow, lifelong disease process, and people of certain ethnicities, particularly people of Asian descent, and especially African Americans, who are 15 times more likely to suffer vision loss as a result of glaucoma. So for all of those reasons, I highly encourage everybody to come in for yearly eye exams. And at those eye exams, everybody is always screened for glaucoma at those yearly exams. So if you are going in for your yearly eye exam, you should be getting screened for glaucoma at that exam. And what I mean by that is you should be getting your intraocular pressure checked, which is one sort of puzzle piece that we eye care physicians use when we are determining if you are at risk for glaucoma. And also at that eye exam, you should be getting dilated, and that physician should be looking in the back of your eye to examine your optic nerve, which is another puzzle piece that we use when we are determining if you are at risk for developing glaucoma. From there, if we feel that anything is off, and we use those two factors as well as your family history to determine if you are at risk for glaucoma, then we will decide how frequently we would like you to get more advanced testing. Things such as screening your peripheral vision and doing more advanced scans of your optic nerve are things that you may have to get every 6 months if you have any of those higher risk factors for developing glaucoma. So with glaucoma, typically, unfortunately, there are not many warning signs. Glaucoma is, in most cases, a slow, painless decrease in your peripheral vision over a lifetime. So some of the saddest cases of glaucoma we eye care physicians come across are, the patients who, didn't go for an eye exam for the vast majority of their lives. And they come in with, this, sort of tunnel vision, and it happens so slowly that they had no idea. In rare cases of glaucoma, this is in the type of glaucoma where you have what we call an acute angle closure attack. The pressure in your eye can suddenly go sky high. That's when the drain inside of your eye closes off. Again, this is very rare, but you would have pain and pressure inside of your eye that would cause you to actually perhaps feel nauseous, see shimmering lights. You can have a painful red eye and blurry vision, which of course I'm sure you can imagine can mimic a whole lot of other syndromes that you may not necessarily associate with your eyes. But like I said, in the vast majority of cases, glaucoma is a slow, painless decrease in your peripheral vision over a lifetime. Yes, there are several different types of glaucoma. The most common type of glaucoma is the type of glaucoma where your eye is simply producing too much fluid. Then there is a lesser common type of glaucoma where we have this drain inside of our eye, and that drain simply gets too narrow. And that's why the fluid gets backed up inside of our eye. Then there's a sort of tricky type of glaucoma where we can have totally normal pressure inside of our eyes, but when we physicians examine your optic nerves, your optic nerve may still show signs of damage as a result of what we suspect is glaucoma. So that's where it can be so important to go into your eye doctor for your yearly eye exams, because that's something that you would never know without having a skilled physician examining the back of your eye for. And then finally, there are these secondary types of glaucoma, which are caused by things such as perhaps taking steroids, which can increase, a portion of the population's intraocular pressures. Diabetes can damage a portion of your eye, which can cause your intraocular pressures to go up and in turn cause a secondary glaucoma. So one of two things typically happens. Either our eye starts producing too much fluid or not enough is being allowed to drain out. Now, there are other less common types of glaucoma where you can have totally normal pressures inside of your eye, but still have damage to your eye that is indicative of glaucoma. So glaucoma is slow progressive damage to the optic nerve, and it is typically, but not necessarily, caused by high eye pressure. That high eye pressure slowly over your lifetime will, as I mentioned, damage your optic nerve, and that will in turn decrease your peripheral vision slowly, typically painlessly over your lifetime.